Out of all the conditions that have been studied for the presence of SIBO, you easily exceed 150 million people. But what I saw was someone would test positive, and then they'd take steps to eradicate the SIBO or the colonic dysbiosis, and normalize breath hydrogen gas, and some phenomena would go away. Their irritable bowel syndrome would go away. Their ulcerative colitis would be less bothersome. Their hemoglobin A1C finally drop. Their weight loss plateau would finally give way. In other words, I saw clinical correlate of the normalization of hydrogen gas, breath hydrogen gas.
Dr. Davis, it's really good to talk to you. It's been about since 2018 when I was listening to a podcast between you and Ben Greenfield, I think, and it was mind-blowing as you started talking about Lactobacillus reuteri and the effects that fermenting it into yogurt has and the incredible therapeutic benefits it has. So when I was a freshman in college, back to 2014, I was diagnosed with a very severe case of ulcerative colitis. Crazy sick, bleeding all over the place, 10 plus bloody bowel movements per day, in the hospital for 2 weeks. And when I got out, I basically went the traditional medicine route. And fortunately, I had really good docs that were able to prevent me from having to have my colon removed or anything like that. But as the case generally is, you kind of start failing medication classes after having some therapeutic response and feeling good. And then eventually I went on this whole crazy tangent after all the medicine wasn't really working. I started a kind of a gut microbiome targeted approach, and I've been in clinical remission since the end of 2016 with very few deviations, and I've had really good clean colonoscopy scans. And so when I heard that podcast about Lactobacillus reuteri, I immediately started making it. I was going to add that to my regimen, and it really improved a lot of things. But the main things that it improved were my sleep and my mood that I noticed. My bowel movements were already pretty good, and it helped there as well. But anyways, it was awesome. And ever since then, I've been really interested in your work and been following everything you do. So I'm really, really excited to be talking to you. You're a celebrity in my world.
Oh, thank you, Kenny. That's fantastic that you managed this on your own. What's great, of course, is I know you're studying to go into medicine, but it's always impressed me for many years, Kenny, what's possible outside of healthcare. That was my motivation, for instance, for writing the book Undoctored some years ago, was that I saw you're part of a new generation that their eyes are open. But guys my age, doctors my age, you know this, are stuck in their ways. They're stuck in the pharmaceutical and procedural world. And they would say, oh, it was just coincidence, Kenny, that you got better. It had nothing to do with your lifestyle. In fact, one of the first cases that made me write the Wheat Belly book was a school teacher with ulcerative colitis. She comes to my office for palpitations. And we do the usual stuff. An echocardiogram, it's normal. We do a Holter monitor, EKG. She's got premature atrial contractions, right? You and I know it's benign, not going to do anything, right? So I reassure her, but she's sitting there the whole time clutching her abdomen like this. I said, well, is something wrong? She says, well, it's my ulcerative colitis. It's been acting up. I'm on the Asacol, prednisone, and a biologic. She's a school teacher. Husband is a cop, so they had good insurance, but not a lot of money. And she's paying, this goes back maybe 15 years, and she's paying $4,000 a month out of pocket to cover the uninsured part of the biologic.
Wow.
Well, she's clutching her abdomen. She says, they're telling me I need to have my colon removed, a complete colectomy, get an ileostomy bag, because I'm not responding. And as you experienced, she was hemorrhaging, getting a couple of units of red cells every month or so. So they're scheduling her for a colectomy. I said, well, let me tell you what I do with most of my other patients. You're here just for palpitations. I didn't get too far into lifestyle. And I told her we did wheat and grain elimination, address some basic nutrient deficiencies, things like that. And this was before I really dove deep into the microbiome. Well, she says to me, no, they biopsied me twice. I don't have celiac disease. They did all the blood markers. I don't have celiac. I said, I understand. You have nothing to lose. They're going to do a colectomy, right? She comes back about 4 weeks later, smiling, jumps on the table. I said, well, tell me what happened. She says, within 5 days, all the diarrhea and bleeding stopped. After 2 weeks, I felt so much better. I felt normal. I stopped one of the drugs, stopped another drug, and then subsequently stopped the third drug. Lost 38 pounds.
Wow.
And I didn't even tell her that she'd lose weight. So she loses 38 pounds by accident. And here's what got me, though. So she says, I'm normal. I'm normal for the first time in years and years. She goes back to her gastroenterologist. And he says, what's going on? She says, I'm better. I'm normal. And he says, well, what did you do? She said, well, I went wheat, grain-free, blah, blah, blah. And he says, it's coincidence. Go back to what you're doing. And that was one of a series of experiences, Kenny, that I knew that I had to, you know what? You know this. This evidence is already published. It's not like you and I have to invent stuff. It's out there already. But it's not making mainstream consciousness among our colleagues. And so that's why I do the things I do, because so much, there really is so much already known, but not being put to work.
That is so incredible. And that's really awesome that just the one change with the gluten was that powerful for her. That's really, really cool. Speaking more about ulcerative colitis, something that you mentioned in your book, Supergut, that really has just recently become more important to me, because generally I focus on the gut microbiome, and I've kind of not really paid as much attention to things like the mucus layer and maybe the actual amino acids and different nutrients that would support the epithelial lining of the gut barrier. But in terms of the mucus layer, I didn't realize how important that was, and how in IBD it can be patchy or thin or depleted in areas, contributing to the ulcer pathogenesis. And in your book, I believe you mentioned several different ways that that you can help support that. Are there any really good things that you found to be helpful for IBD, or really just in general for increasing the mucus layer?
There's a number of things, as you know. Fermented foods is at the top of the list, which is kind of counterintuitive, right? So it's been known for years, if you eat sauerkraut or kimchi or kefir or whatever, you're getting microbes like Leuconostoc mesenteroides, or Pediococcus pentaceus, or Pediococcus acetylactici, or Weisella species. Species that don't colonize the human gastrointestinal tract. So what good are they, right?
Right.
Well, the work of the Sonnenbergs, the husband-wife team from Stanford, they did the most elegant work. Then people who consume fermented foods and thereby get those microbes that don't colonize the GI tract, their presence as they pass through from mouth to toilet somehow cross-feed or cultivate the proliferation of the species you want, including mucus-supporting species like Akkermansia, Mucinophila, mucus lover, or Fecalibacterium, other beneficial species, and including species like Fecalibacterium and Lactospiraceae, Ruminicacea, and Eubacteria, that are butyrate producers or butyric acid producers that in turn, of course, cultivate mucus production. And so while there's more to do, fermented foods stand at the top of the list counterintuitively. Even though they have microbes that don't live inside of you, they just somehow cross-feed. Now, it's not quite clear exactly how that works. The Sonnenbergs speculate that they must be present in very low numbers, maybe sequestered in the mucus barrier or something like that, because you can't grow them out of nothing. Just like you don't get rats out of a pile of rags. So you can't get microbes. They have to be somewhere, or either that, or somehow the presence of the fermented foods makes you more receptive to being colonized with contact to other people or animals or whatever. So no one really knows. I think the most plausible explanation, though, is the cultivation of quiescent microbes.
Cool. Okay. That leads me to kind of another question that I get a lot in relation to that is because I push fermented foods all the time. And the main things that I would attribute to the improvement in my health was drinking a lot of kefir and then lots of fermented vegetables that I was making at home. And again, kind of going back to all this, in 2014, well, I guess it was 2016 when I started doing this part, but the gut microbiome wasn't nearly as popular as it is now. And so I was just surfing the internet, reading mom blogs, and I stumbled across the gut microbiome. And I had no training in scientific research or how to read scientific literature. And I just started scanning abstracts, and committed kind of a cardinal sin. But reading the abstracts, I read IBD patients consistently seem to have a dysbiotic gut microbiome. And so not knowing how to do anything or what to make of that, I just thought, well, what if I tried to fix my gut microbiome then? That just kind of seemed intuitive to me. And so reading the mom blogs, found all this stuff about kefir and fermented foods. And so I started making it and consuming lots of it. And so when I started making YouTube videos and explaining the different foods that were helping me, a lot of people would say, hey, Kenny, when I eat the fermented foods, I seem to have a histamine intolerance and I can't really tolerate them very well. Is there a way to kind of solve that, or how would you go about tackling that?
Yeah, so, people think that histamine is a bad thing. No, it's a normal thing. It's like saying, insulin's bad. No, insulin, you need insulin. If you don't have insulin, you're a type 1 diabetic. You can die without insulin. Histamine, likewise, it's a normal signal molecule. And we're supposed to have numerous species that metabolize histamine for us. So the problem in histamine intolerance is that people have lost. It's so telling. There's one study, for instance, it was 5 days of an antibiotic. I think it was clarithromycin. 5 days, Kenny. And over 1,000 microbial species were lost. I mean, antibiotics decimate the gastrointestinal microbiome. So when you lose species that metabolize histamine, and you take foods like fermented foods or Lactobacillus reuteri that produce histamine, it brings out histamine intolerance. The problem is not the food. The problem is the disrupted microbiome. It could be histamine intolerance. It could be FODMAPs intolerance. It could be nightshade intolerance. It could be legume or fructose intolerance. Any number. These people who say, I can only eat 8 foods. Those are all SIBO. Those are all small intestinal bacterial overgrowth. The situation, of course, where fecal microbes have been allowed to overproliferate in the colon because of antibiotics and glyphosate, perhaps, and other things. But then they ascended into the small intestine. Kenny, the small intestine is very permeable because that's where we absorb amino acids, fatty acids, vitamins, minerals. So the small intestine is by design very permeable. But when there's colonization by fecal microbial species, E. coli, Campylobacter, Pseudomonas, Citrobacter, Klebsiella, the gram-negatives primarily, some of the gram-positives too, like Streptococcus, Staphylococcus, but mostly gram-negative fecal species. When they come to colonize the small intestine, it amplifies its permeability because it inflames the small intestine. Microbes don't live very long. Hopefully you and I live for many, many decades. But microbes live for a few hours. When they die, they shed their toxic components, particularly of their cell walls, like the lipopolysaccharide endotoxin of gram-negative species, that then enters the bloodstream. Endotoxemia. So this is leaky gut, people say, that's been suspected for a long time by the natural health community, but finally validated by Patrice Canny and his group in Belgium in 2007, and then since validated numerous times. This is a real thing.
Yeah.
Entry of endotoxin into the bloodstream that causes endotoxemia. Interestingly, of course, the portal venous system is the primary drainage of the gastrointestinal tract. That goes straight to your liver. So your poor liver takes a beating from portal vein endotoxemia. Then, of course, liver filtration, and there's still some entry of endotoxin into the bloodstream. So we know with good evidence there's about a 2 to 4-fold increase in endotoxin serum levels when you have SIBO. And that, I think, is I think it hasn't reached broad consciousness yet just how prevalent SIBO is. You know, if you and I go to the dozens of studies where this question was asked, in condition blank, what proportion tests positive for SIBO? Usually via hydrogen gas testing on the breath. So if we insert like ulcerative colitis or fibromyalgia or irritable bowel syndrome, so let's take obesity. In obese people, what proportion tests positive for SIBO? About 50%. So that's 50% of 110 or so million Americans. Well, that's 55 million people right there with SIBO.
Wow.
How about irritable bowel syndrome? Well, there's 60 to 70 million Americans with IBS. What proportion tests positive? Well, it differs from study to study, but about 31%. That's another 18 to 20 million people right there. Out of all the conditions that have been studied for the presence of SIBO, fibromyalgia, restless leg syndrome, Alzheimer's, Lou Gehrig's disease, Parkinsonism, rosacea, psoriasis, rheumatoid arthritis, lupus, on and on. You easily exceed 150 million people.
That's
Now,
crazy.
there's overlap, of course.
Yeah,
Obese type 2 diabetic with fatty liver, of course. But it's not rare. I used to think it was rare, but it's not. It's everywhere. And do you know about this device, the AIRE device?
I read about it in your book. Tell me about it.
So this is the original. It measures hydrogen gas. The more recent, and I have no relationship with the company. I know the inventor, Dr. Angus Short, PhD engineer. Here's the more recent version, measures hydrogen gas and methane. So there's a prep you have to go through, blow into it, talks to your smartphone, 0 to 10. What it is, Kenny, is a mapping device. And Angus Short, a PhD engineer, didn't understand that. So when I got a hold of it in 2018, I called him. I said, Angus, it's not what you think it is. The guy who invented it. I'm telling the guy who invented it. I said, it's a mapping device. It's a way to map where microbes are living by timing how fast you produce hydrogen gas. Because microbes produce hydrogen gas, but we cannot. So you can use that phenomenon to map how far down microbes are living. And what I saw was it's almost immediate. Modern people produce hydrogen gas very quickly because there are microbes living in the stomach, duodenum, jejunum, where they're not supposed to be, at least not the ones that produce hydrogen gas. And when I started having people tested, now we have thousands and thousands of people, it was shocking that it was everywhere. Now you might say, well, maybe the device is flawed, maybe the technology is flawed, but what I saw was someone would test positive, and then they take steps to eradicate the SIBO or the colonic dysbiosis and normalize breath hydrogen gas, and some phenomena would go away. Their irritable bowel syndrome would go away. Their ulcerative colitis would be less bothersome. Their hemoglobin A1C finally drop. Their weight loss plateau would finally give way. In other words, I saw clinical correlate of the normalization of hydrogen gas, breath hydrogen gas.
Wow. Okay. That's pretty cool. And that's because I remember when I first kind of learned about SIBO a long time ago that it was notoriously difficult to test for. And that is so cool. Now you can carry that around in your pocket, essentially. That's really cool. Okay, so with the histamine intolerance and the prevalence of SIBO and that whole interrelational pathogenesis, if you were going to attack SIBO, one of the coolest things I learned about L-reuteri from you is that it's one of the most effective things to help combat SIBO because of the bacteriocins and the different mechanisms that it has to cull pathogenic bacteria or bacteria that are just in the wrong location. So if you were going to start attacking SIBO with, say, something like L-reuteri or fermented foods, how would you go about that? Would you kind of start with like a low dose, or do you just kind of blast it?
Well, what I did originally was using very basic reasoning, Kenny. Here's what I asked. If you had SIBO, right? So 30 feet, 24 feet small bowel, 4 to 5 feet colon, filled with fecal microbes, and is giving you, let's just say, Crohn's disease or irritable bowel syndrome or type 2 diabetes or overweight, whatever, right? If you took a commercial probiotic off the shelf, what's the likelihood the SIBO will go away? Very low. They're not very effective. modern probiotics, for the most part, are concocted in very haphazard ways. They're just kind of haphazard slapdash mixtures of microbes, so not very intelligently formulated. What if we did this instead? What if we chose microbes known to colonize the small intestine and colon, and as you point out, produce bacteriocins? That is, natural antibiotics effective in killing fecal microbial species for the most part. So in my Super Gut book, I called it SIBO yogurt because I combined Lactobacillus reuteri, strain of Lactobacillus gasseri, and the original recipe included Bacillus coagulans. That doesn't colonize the small intestine, it germinates, it's a spore former. Well, over time it became clear coagulans, it's a really interesting microbe, but not very reliable for fermentation in dairy, because we're going to ferment in dairy. So I replaced it with Bacillus subtilis. And I think it was a good move because subtilis likewise germinates in the small intestine and is a champion at bacteriocin production. And then we've used prolonged fermentation. So 36 hours. You know, if you make yogurt in a factory, you ferment like 6 hours. We're going to ferment for 36 hours. So Lactobacillus reuteri, for instance, doubles. As you know, microbes don't have sex. There's no male and female microbes. They just double themselves, asexual reproduction. Reuteri doubles itself every 3 hours or so at human body temperature. So we're going to let it double 12 times. We did flow cytometry on these mixtures. We get about 300 billion. So it's a cheap, easy way in your kitchen to get these huge numbers of microbes. And so far, those 3 microbes, you can ferment them individually or you can ferment them in combination. The only drawback a combined fermentation is you probably have to start from scratch every few batches because there's probably a shift in relative proportions of the microbes. We haven't yet done DNA sequencing to see what the relative populations are. In other words, does one of those species take over? We don't know. So we'll do that. I have a clinical trial that I'm still writing, a pilot trial, then a randomized placebo-controlled clinical trial. We can't use yogurt. You can't count on people to make it at home. We'll have to encapsulate it. But we'll do that clinical trial because I believe, consistent with what's happening with the SIBO yogurt, we have something that I think is at least as good as any antibiotic.
Wow.
We still do use antibiotics, though, because of the histamine intolerance. Those people just can't tolerate the reuteri or fermented food, so we still revert back to antibiotic in some form. I've been using, there's only 2, as you know, herbal antibiotic regimens that have had any kind of clinical validation: the Candibactin AR and BR products and the FC Cytal with dysbiocide. Only those, there are other products, but they've not been validated. And as you know, you just can't throw something at people as an antibiotic and hope it works. It doesn't work that way. So the only clinical evidence we have for those 2 regimens was a Hopkins study comparing those 2 regimens to Xifaxan, rifaximin, the conventional antibiotic, and lo and behold, they seem to outdo rifaximin and actually worked even when Xifaxan failed. So those do work. The downside of that, Kenny, is antibiotics, whether herbal or conventional, don't rebuild the microbiome. They just kill things. So if people can, I'd prefer they use the SIBO yogurt in some form because not only do they kill the invading fecal microbes, they also begin the process of rebuilding. The Reuteri, gasseri, Bacillus subtilis, like the fermented foods, they cultivate the proliferation of all those beneficial species. They increase the production of butyrate, all that kind of stuff.
Got it. Okay, so bringing this full circle, if someone is struggling with histamine intolerance because of SIBO, the conventional therapy would be to use some sort of antibiotics, whether actual antibiotics or an herbal antibiotic, to kind of help decrease the pathogenic bacteria that are causing the histamine intolerance and then repopulate with the SIBO yogurt.
Exactly. Yeah. And other efforts like fermented foods. Because once you get rid of the invading fecal microbes and you start to cultivate histamine metabolizing species, people become once again tolerant to histamine in foods, as well as FODMAPs, nightshades, all that kind of stuff.
Cool. Okay. All right. That leads me to kind of another thing. So I don't ever recommend this to other people, but I can't help my personality in the way that I do this. I'm either kind of all in or don't do it at all. And so I kind of taken this shotgun blast approach where I consume a lot of fermented food. So like on a daily basis, I'm generally consuming a liter of homemade kefir, and I've been consuming about 2 cups of L. reuteri yogurt a day. I have some honey on top of it with some blueberries. So I'm consuming massive amounts of fermented foods. And people often ask me, can you take too much? And I don't really know the answer. I just know that this is what I feel good on. So what do you think?
As you know, nobody really knows. No one's ever done that. I'd say, Kenny, I want to put you in my clinical trial. I want to see if there's a toxic effect when we get to 5 trillion.
yeah, that's
No one's done it.
Yeah.
Probably not. I've taken up to 1 trillion of Reuteri and had no adverse effect, nor further benefits either.
Wow.
So, but I don't know of anybody, unless you're immunosuppressed, as you know.
Okay, that makes sense. So another kind of fun addition to our lives is my wife and I had our first son 10 months ago, and we've been giving him L. reuteri yogurt all the time because I'm very, for whatever potential there is for a genetic predisposition to ulcerative colitis, I'm very protective of his gut microbiome. And so we've been giving him L. reuteri yogurt, a ton, basically at every meal ever since he started introducing foods a couple months ago. And I've been considering adding in I believe it's Bifidobacterium infantis yogurt that you described in your book. So if I were going to go about that, how would you generally suggest you start? Just like a tablespoon a day, or could you go a little higher?
You raise an issue, Kenny, that I'm very interested in because I have a daughter-in-law who's literally any day now is going to deliver her 3rd child.
Oh, congratulations.
This is a girl with celiac disease, pretty much in remission, but she's got a gastroenterologist, an endocrinologist, a rheumatologist, a functional medicine doctor, a primary care doctor. She's got something like a dozen doctors.
Yeah.
No one mentioned anything about the microbiome during her pregnancy. And in fact, her obstetrician said, don't bother with probiotics. They've been proven to be ineffective. You and I know that's the most absurd thing ever, right?
Yeah.
So with the infantis, so there's a product called Avivo, as you know, EVIVO, the EVC001 strain, and they did very good work at University of California, Davis on this microbe. They originally sold it as like a Keurig type cup thing, where mom opens it, expresses some breast milk, mixes it, and feeds it to the child. And that was shown to have great benefits in the first year of life. When Bifidobacterium infantis is known to dominate, it becomes very different from an adult microbiome. Bifidobacterium infantis becomes the dominant microbe in the infant's gastrointestinal tract, and it allows that child to metabolize the human milk oligosaccharides in breast milk. And should that child have both those things, Bifidobacterium infantis and breast milk, it has better neurological maturation, has a higher IQ, less prone to type 1 diabetes and other autoimmune conditions, less likely to become obese or a type 2 diabetic as an adolescent. So huge benefits. What I told moms, though, was, now wait a minute here. Why not do the way it's supposed to? Mom probably doesn't have infantis because Bifidobacteria, like lactobacillus species, is very susceptible to common antibiotics. So the amoxicillin you took years ago probably wiped all that stuff out. So why not do it this way? Get that product, make yogurt out of it, or other fermented. Doesn't have to be dairy, but dairy is so forgiving, as you know. We make yogurt out of it, and mom consumes it during pregnancy. And then she delivers a child, vaginally hopefully, and breastfeeds her baby, and she gives the baby the infantis the way it's supposed to be in the context of a broader microbiome. So I've suggested to ladies they do that. They don't necessarily have to use prolonged fermentation because we don't, no one wants to test what happens in pregnant ladies, right?
Yeah.
So one way to do it would be do briefer fermentation, like 24 hours, or even do a polymicrobial fermentation. One easy trick is get the microbe of interest, in this case Bifidobacterium infantis, ferment it, but throw in some live culture yogurt you got at the grocery store that has some Lactobacillus bulgaricus and Streptococcus thermophilus, maybe some others. And that when you have a mixed fermentation, you have lower counts of all the microbes. So maybe a little safer for pregnancy. Because these are microbes a woman's supposed to have. And by the way, there's so much a woman can do in pregnancy to reduce her risk of complications. I'm shocked. This is not passed on to late. For instance, Lactobacillus crispatus. As you know, Kenny, the vaginal microbiome is very different than the gastrointestinal microbiome. It tends to be dominated by only a handful of species, but specifically Lactobacillus crispatus. So interesting. If a woman lacks it, because it's a lactobacillus species, susceptible to antibiotics, she's more prone to candida infections, bacterial vaginitis, more prone to miscarriage, more prone to premature labor. And as you know, premature delivery of a child can be catastrophic for a lifetime for that child, for that person. She's less likely to contract sexually transmitted diseases. She's less prone to urinary tract infections. She's less prone to incontinence. And so very important to have that microbe, and a woman can get it. And one of the things we do is we make yogurt out of it and makes it delicious. We call it vagina yogurt.
Yeah.
It's delicious.
Yeah.
It's one of the most tasty yogurts ever. It's very smooth. The Reuteri tends to be kind of sour.
Mm-hmm.
The crispatus yogurt is very smooth. Almost tastes like heavy whipped cream.
Okay. Interesting. So, in terms of for an adult, with the Bifidobacterium infantis yogurt, would that be really helpful, or is that really, like for me, would that be something that I should add to my regimen, or not really at this stage in my life?
It has been shown to have beneficial effects in adults, but they're much more modest. They're not as dramatic as in newborn.
Okay.
But it's probably best to get a whole bunch of bifidobacteria, especially in the wake of COVID, where there's something weird about that virus that seems to specifically wipe out bifidobacteria species, of which there are many, of course.
Oh, wow. I didn't know that.
Yeah, so the easiest way to do this would be to get a bifidobacteria rich probiotic. And what we often do is we ferment it. You and I don't want to spend a ton of money on probiotics, so you can ferment it as yogurt or other fermented foods. By the way, for your listeners, it helps when you're fermenting things to break microbes that ferment in two basic groups. Microbes that ferment at human body temperature and microbes that ferment at room temperature. Because if you try to ferment something, let's say, at room temperature, but it's meant to be body temperature, you won't get much in the way of fermentation. So like bifidobacteria and lactobacillus species tend to be human body temperature. Those fermenting microbes, with some exceptions, like Lactobacillus plantarum is an exception, they tend to do fine just at room temperature. So you want to kind of segregate those things in your head so that you get good fermentation results.
Getting back to the mucus layer, in your book I also read about your clove green tea. And so that's something that I have not had the chance to try yet. The way that you make it, do you just brew the cloves in with the green tea, or do you combine them afterwards?
It takes maybe 10 minutes or so to get that kind of clove flavor into the water. So what this is how I did it. And this is by no means to say this is the only way to do it, Kenny. I'm sure there's other ways to do it. Is we just boil the water for maybe 10 minutes with whole cloves, a couple of tablespoons of whole cloves. As it's cooling, then you put your tea bag in it. Trader Joe's has a really good organic green tea that's very high in catechin content. And then I add inulin. The whole rationale was the eugenol essential oil of clove thickens a mucus barrier, at least transiently. The epigallocatechin and other catechins from green tea are very good for cross-linking the mucin proteins in mucus, converting mucus from a semi-liquid to a semi-gel. And then the inulin, if you can tolerate it, is very good at cultivating mucus-producing species like Fecalibacterium and Akkermansia. And what people find with this clove green tea is very soothing. People tend to get a lot of relief from gastrointestinal distress. It's not meant to be a long-term thing. It's just meant to be kind of a short-term way to get some relief from, discomfort, bloating, etc., that kind of stuff.
Got it. Okay. Interesting. So another thing that I was thinking about as I was going through your book, they had so many different types of yogurts and fermented foods. And so I was curious about your kind of daily routine in general, your meals, whether you cycle the yogurts or if it's just kind of condition specific. And if you don't have a specific condition bothering you, you don't really use this microbe. what does your daily routine kind of look like?
So if you have SIBO, it helps to get the SIBO yogurt concoction once a day, maybe half cup per day for a minimum of 4 weeks. And then I encourage people to continue to do it at least occasionally, like 2 or 3 times a week, because it loves to come back. And those microbes have distinct benefits of their own. So there's reasons to continue those microbes long term, at least until we figure out how to cause permanent colonization. Nobody knows how to do that yet, right? In other words, if mom gave you Reuteri at birth and you were never exposed to antibiotics or other factors, you'd have Reuteri for a lifetime. Well, how can we get it as a yogurt or other fermented food? We have it for a few days, maybe weeks. Why? Probably the lack of what's called a collaborative consortium or guild of microbes. I think in future we'll probably say something like this. If you get Reuteri, make sure you get it with these 5 or 7 other species, and it'll take up permanent residence that way. But we don't know how to do that yet. So there's value to doing that. For me, the Reuteri provides deep sleep. I'm a chronic insomniac, which helps when you're in training, right?
Yeah.
But not when you're well beyond. And the Reuteri helps me sleep. You can also tell. People often say this. They said, I didn't realize how much better and happier I was till I stopped the yogurt. And I felt that old edge come back. I was more irritable. I snapped at other people. I didn't like going to social events because I got kind of nervous, social anxiety. And so there's value in continuing these things long term. As you do, lots of fermented foods, kefirs, kimchis, all that kind of stuff. I try to get a little fermented food and some fibers, prebiotic fibers, with every meal, rather than have to think about it. Just make it part of your habit. If you make an omelet, for instance, make sure there's some onions and garlic and maybe some black beans woven into the thing. Try to always incorporate a source of fiber and include, as you do, a fermented food with every meal.
Got it. Okay, that makes sense. So another thing, sorry to keep bugging you about fermented foods. I'm a big fan. But another thing that people talk to me about when discussing fermented foods, if they're trying to kind of follow any kind of diet that's similar to what I was doing that I saw success with, they'll say, "Hey, Kenny, I've been doing the fermented foods, been doing the probiotics, and been kind of following the general healthy diet type stuff, and I started seeing improvement, and then I felt like the probiotics were making me worse, and then they just stop them." And why do you think that is, and what could they do to kind of get past that, so to speak?
As you know, probiotics are a work in progress. People often say probiotics 1.0. So this is how a probiotic is formulated. You and I say, let's make a probiotic. And I say, hey, I think Lactococcus lactis is a good microbe. You say, throw it in there. And then you say, hey, I think Lactobacillus bulgaricus and Lactobacillus acidophilus are good microbes. Throw it in. And then we just throw a bunch of microbes together. There's no rhyme or reason. There's no factoring in collaborative or shared metabolite effects. And then there's also gimmickry thrown in. So some companies will do things like double encapsulation. That is, put the microbes in a capsule and then put another capsule around it.
Yeah.
That the release is delayed into the colon. Well, that's kind of dumb because we're not released into the small intestine for all those microbes that don't belong in the small intestine. Or trying to cram as many species. There's one product that had 100 different species in one capsule. And each species, of course, is present in very low numbers. And half of them were proteobacteria, which is weird. That's probably not going to pass FDA scrutiny, by the way, because you just can't put fecal microbes in a capsule and call it a probiotic. You can't do that. So there's a lot of gimmickry going on in the probiotic world. So the point is that the current crop of probiotics are not very intelligently created. I think that's going to improve over time as our understanding of what works. Another thing is you can't put all good species into a probiotic capsule because they die upon exposure to air or to oxygen. That was the difficulty with Akkermansia, of course. There is a commercial product that has live Akkermansia, though present in very low numbers, because apparently the polysaccharide coating is not perfect. But there's going to be, I think, a time where you and I can get so-called probiotic 2.0 species. It could be Fecalibacterium. It could be other species that usually die upon exposure to air. So that's going to improve things also. But what I tell people is the least important thing you do is take a commercial probiotic. It's the least important, especially in their current form. So what's more important? Well, remove the factors that disrupt the microbiome, limit your exposure to antibiotics, avoid foods with preservatives and emulsifying agents, process ultra-processed foods with long lists of crazy ingredients, eat whole foods. Filter your drinking water because chlorine may have an effect on the mucus barrier as well. So clean up your life and then get fermented foods and probably ferment some of these keystone microbes. Lactobacillus reuteri, Lactobacillus gastritis, Bacillus subtilis, even that's a composition of the so-called SIBO yogurt. Those are also keystone microbes that bring back other beneficial species. And then, of course, the fermented foods and fibers. And that has worked really well. And the commercial probiotic, maybe it's kind of like icing on the cake.
Okay, that's good to know. I used to spend a lot of money on probiotic capsules and supplements, and really the thing that made the biggest difference for me was foods always. So that's really good to know. As people are kind of working through improving their gut or trying to improve their gut, what have you seen become kind of the sticky point or the most common mistake that people make that seems to hinder that process?
It is truly a work in progress, but falling off the wagon, even though you and I are focusing most on the microbiome, there are basic things that matter also. Like the diet we use is no wheat, no grains, no sugars. That alone is hugely powerful for a whole bunch of reasons. This is kind of off topic, Kenny, but one of the most primary potent causes of coronary disease, heart attack, sudden cardiac death, need for bypass surgery, stents. That's the world I came from. The most potent trigger is grains. The amylopectin A of wheat. People say, "Oh, I'm gluten-free." That's not the gluten that's the problem for a lot of it. It's the amylopectin A that triggers hepatic liver de novo lipogenesis. That is the liver's capacity. Your liver has the great capacity to convert carbohydrates and sugars, like the amylopectin A of grains, to triglycerides that get packaged by your liver as very low density lipoproteins, VLDL. VLDL enters the bloodstream. VLDL itself is a cause for coronary disease because it can enter the arterial wall. But VLDL also interacts with LDL particles. And there's a series of enzymatic reactions that occur either at the endothelium or in the plasma that converts it to small LDL, the major driver of cardiovascular risks. So, Kenny, we have a world, American Heart Association, U.S. Department of Health and Human Services, USDA, Academy of Nutrition and Dietetics, on and on, who all say, they all agree, cut your fat, cut your saturated fat, eat more healthy whole grains, a formula that causes coronary disease. It's shocking to me. This still goes on 60 years. And you know what? The evidence is quite clear. This is not my speculation, by the way. There are 55 clinical trials demonstrating that the measurement of small LDL particles is dramatically superior to this ridiculous, outdated idea of LDL cholesterol. That is a crude, indirect marker. But anyway, how do we get on this?
No, this is great. I have a question about that. So am I understanding correctly that essentially the amylopectin A that you're consuming triggers a type of fatty liver disease, which releases the LDL triglycerides into your bloodstream, and that is what ostensibly can cause a coronary vascular disease?
Yeah, you don't have to have fatty liver, but it can be worsened by fatty liver. So when the liver makes triglycerides from the amylopectin A, it can't release triglycerides into the bloodstream because fats coalesce, like salad dressing, right? It separates into an aqueous water and vinegar layer and an oil layer. So oils tend to coalesce. So if the liver released triglycerides into the bloodstream directly, they would coalesce and you would infarct all your tissues.
Okay.
So it packages it with other things, proteins, a lipoprotein, so it solubilizes in an aqueous medium. blood.
Got it. Okay.
That's why your liver makes VLDL. Now, some of those triglycerides, by the way, don't get out into the plasma as VLDL, but stay put in the liver. That's the origin of fatty liver. So triglycerides from the consumption of sugars and the amylopectin A of grains. My point was this. So even though we're focusing on the microbiome, basic efforts in your diet and addressing certain nutrient deficiencies still does matter. And a lot of those nutrient deficiencies, like omega-3 fatty acids, that you're supposed to get by eating brain matter and all the fish you can, but we can't. No one eats brain anymore. Can't eat fish that much. It's got mercury and cadmium. And so we have to supplement omega-3s. And that has a major effect on reducing the lipopolysaccharide endotoxin in the intestinal wall because it activates an enzyme, alkaline phosphatase, that partially deactivates the lipopolysaccharide. So even the basics, vitamin D, major player in the intestinal immune response. So even the basic stuff does play a role. And of course, wheat, grain, and sugar elimination is hugely beneficial for gastrointestinal health, contrary to conventional thinking.
Yeah. I mean, that makes sense. So it really is kind of the boring foundational building blocks that you need to take care of that essentially move the needle the most. That makes sense.
You may recall from your ulcerative colitis days that there's several toxins in modern wheat, but especially wheat germ agglutinin. Sounds like gluten, but it's agglutinin. As you know, that means it agglutinates or clots blood when exposed to blood. So wheat germ agglutinin in modern wheat, enriched because farmers like it, because when they cultivate strains of wheat that have higher content of wheat germ agglutinin, it protects the wheat plant from insects and molds. So they've increased wheat germ agglutinin content by hybridization and cross-fertilization, those kinds of things. And modern wheat is much higher in wheat germ agglutinin, which is a very potent bowel toxin and is very toxic in ulcerative colitis and Crohn's disease. So,
Okay. I didn't know that. That is really interesting information. Yeah, I mean, I ended up stopping most gluten anyways, just because I knew I felt so bad anytime I ate it. But that's a really interesting mechanism. Okay, so now all these different pathways have piqued my interest. Also, in your book, you talk a lot about how different chronic diseases like fibromyalgia or even endocrine diseases like type 1 or type 2 diabetes rather can be essentially predisposed if your gut's messed up. What exactly is kind of the relationship there? So if you have a bad gut, how does that potentially contribute to something like metabolic syndrome or diabetes?
well, the primary mechanism is this process of endotoxemia. So endotoxin, so the very permeable small bowel, colonized by those invading fecal microbes that die, release their endotoxin into the intestinal lumen, that thereby gains access into your bloodstream. So the level of endotoxin in your bloodstream is higher, and that drives insulin resistance. It drives liver de novo lipogenesis, the liver's production of VLDL and small LDL. So that portal vein endotoxemia is a major amplifier of VLDL and small LDL production. So SIBO and endotoxemia is a major cardiovascular risk factor. It also drives atrial fibrillation, cardiomyopathies, Alzheimer's, cognitive decline, other neurodegenerative disorders, skin disorders like rosacea, psoriasis, musculoskeletal disorders like fibromyalgia and rheumatoid arthritis, restless leg syndrome. And you'd be hard pressed, Kenny, to identify a common chronic disease that's not either initiated or worsened by SIBO and endotoxemia. This is it's probably a major risk factor for cancers also.
Wow. Okay, so it really does kind of predispose you to just about anything, or at least set the stage for different environmental triggers to initiate those those pathogenic states.
In dementia, so we know that endotoxemia is a major driver of the production of beta amyloid plaque and phosphorylated tau in the brain, as well as other issues like increased blood-brain barrier permeability. So we know that endotoxemia is a major driver of dementia. Now, the pharmaceutical world is busy giving people monoclonal antibodies against beta amyloid plaque. And of course, it doesn't work. It gets rid of beta amyloid plaque and your brain shrinks, it atrophies. And not saying, well, how did the beta amyloid plaque and phosphorylated tau get there in the first place? One of the drivers, SIBO and endotoxemia. So, I think you can see this. What's so exciting about your life is you're starting this thinking really early in your career. I started doing this in my 50s, for God's sake.
Yeah.
So it's very exciting that someone like you starting out has eyes open to all this stuff. Because I fear the physicians in my generation have to die and let the young people take over.
I don't know. I'm learning quite a bit from you, so I don't know. We're doing okay.
Well, I do fear for you. You're on rounds, and you say, "Hey, doc, you're saying to your attending physician, this looks like SIBO to me. This looks like a." They say, "What are you talking about?" I
keep my mouth
that
shut.
My training in 1993.
Yeah.
Yeah. So,
that's interesting. You have an impressive recall of all these different studies. You just spend all day on PubMed. Like, how in the world do you remember all these right off the top of your head?
you know this. You really learn something when you teach it. And one of the things I do is every once a week, I have about a 2-hour session with about 100 some people who are in my programs, and we talk about these things, basic things. Oh, my Reuteri yogurt didn't turn out, or more important things like why we focus on issues like vitamin D and the diet and things like that. So teaching it really helps. Conducting research. I don't have a pharmaceutical budget, so our research kind of chugs along very slowly. I wish we had a budget like the pharmaceutical.
Yeah.
Our budget is like a rounding error for pharma. But that also teaches you a lot of lessons. And the great thing about doing some simple research is you learn new things.
Yeah.
So one of the things I've learned recently is the importance, and a lot of people know this, but it really drove it home, the importance of muscle. Because as you recall, as you and I age, we lose about a third of our muscle. You see it in the old people, skinny arms and legs, and sarcopenia in its extreme form, falls, frailty, fractures, loss of independence, and premature death. And so preserving muscle is important. Well, this becomes a really hot button issue in the wake of the GLP agonist world. So heaven forbid, your wife takes Ozempic, Mounjaro, Wegovy, whatever. She loses 40 pounds. It costs you $12,000 or something like that. But she loses 40 pounds, of which 30 pounds is fat, 10 pounds is muscle. Well, think about 10 pounds of ground beef on your kitchen table. It's a lot of muscle. She stops the drug because few people can afford that forever. She regains 32 to 34 pounds as fat, mostly in the abdomen, abdominal visceral fat, gains very little muscle. She's now more insulin resistant, more likely to be a type 2 diabetic, pre-diabetic, hypertensive than she was at the start. And the loss of muscle. There are large databases that have followed people for many, many years who lost weight, like Epic Norfolk and NHANES. And it's becoming clear, people who lose weight by cutting calories, could be GLP-1 agonists, could be a diet program, could be a bariatric procedure. Those are all variations on the same theme, losing weight by cutting calories. You lose muscle. And it's becoming clear you're likely to die several years earlier than you should have. So here we funneled billions of dollars to pharma for the privilege of dying younger. I'm shocked by this, Kenny, that this goes on. But I do believe we have ways to rebuild muscle. And I'm not talking about silliness, like going to the gym, 3 days a week for an hour and a half. Oh, metabolic ways.
Okay. Cool. Interesting. So that makes you think. I bet that those GLP-1 agonists also mess up your gut microbiome and probably predispose you to SIBO too.
I've not seen that evidence, but I wouldn't be surprised. As you likely know, the list of pharmaceuticals that clearly have an impact on the microbiome is growing. When a drug company makes application to the FDA, there's no requirement that there's a microbiome assessment before and after, but that they have been done after the fact, and it's become clear that even drugs we thought were benign, like the PPIs, proton pump inhibitors, the Prilosec, Acifex, all those, they turn off stomach acid, which by itself, as you know, allows the descent of oral microbes into the small intestine and allows the ascent of colonic microbes up to the small intestine. So taking a PPI is a disaster for the microbiome. But the PPIs are also antibiotics. It's not appreciated. They're also directly antimicrobial. So the PPIs that were thought for years to be benign, oh yes, stay on forever, they're benign. No, they're not benign. They're very harmful.
Wow. And another thing, I either haven't gotten to this part in your book yet, or I just missed it. Do you drink coffee, or what are your thoughts on coffee?
I try not to micromanage. I think coffee is fine. There's ups and downs with all foods. There's an acute rise in blood glucose. There's a long-term reduction in blood glucose and insulin resistance. There's at least transient cognitive effects. So not a big issue. If you like coffee, drink coffee. I mean, you should try to buy organic, of course, because as you know, coffee beans are doused in herbicides and pesticides. And so that helps also. But, one thing I see, Kenny, a lot going on in the world of influencers, because I kind of bridge a bunch of different worlds, is the need for novelty. And I see a lot of that going on. That is, just because something's novel doesn't necessarily mean it's good for you. And I see a lot of that. I think it's it's always been that way for humans, but I think it's gotten worse. So, for instance, cold water immersion. So people say getting cold ice baths, right, and increases concentration, reduces stress, and that sort of thing. And people die of sudden cardiac death. They forgot about that part.
Yeah.
And this, not my speculation, we know there's plenty of evidence. Let's say you're in the North Atlantic and you fall overboard. People say you're going to die of hypothermia. No, you die of sudden cardiac death within the first 3 minutes. Because one of the things that happened, we did this in the cath lab. We used to look for coronary spasm. So a woman, for instance, comes into the ER, she's having a heart attack, right? ST segment elevation, CKMB rise, all the stuff that marks a heart attack, right? She closed an artery. She's given, of course, sublingual nitroglycerin, topical nitropaste, maybe IV nitroglycerin, vasodilators, chest pain stops. We take her to the cath lab, do a coronary angiogram. Arteries wide open. Where'd the heart attack come from? We inject acetylcholine into her coronary arteries, which unmasks endothelial dysfunction. And it's scary as hell, by the way. Like her LAD just closes down to a thread and she starts infarct right on the table. Sometimes you have to defibrillate her, intubate her, resuscitate her. But now you know she had coronary spasm. Well, that's what happens when you get exposed to cold. It's uncommon, but the dozen deaths that have occurred from cold water immersion have all been young people, mostly young people in their 20s. And so Wim Hof, the Iceman, he's the Dutch guy who's popularized this, now has several lawsuits against him.
Oh, wow.
So I've had to tell some of these influencers, quit advocating this cold water immersion, because you might be named in a class action lawsuit as more people die of cold. So my point is, I'm careful what I say because we don't want people to jump on every. The most recent bandwagon is creatine. Creatine's interesting. I played with it 35 years ago. We know that if you and I take creatine, if your listeners take creatine, it increases muscle. It does. It increases strength somewhat. It also increases water retention. And now it's being touted as something that improves your mental capacity. I'm getting off topic. But
No. This is good. Keep rolling.
But I find it's very helpful. It's one of the things I tell people to help them navigate away from nonsense information. The difference between what's called a nootropic and a neurotrophic. They sound alike, but nootropic, Nootropic, those are things like caffeine, creatine, things you probably never heard of, huperzine, dimethylaminoethanol, acetylcholine. There's about 100 of them. These are things that make you a little bit smarter for a few hours, improve memory, concentration, focus, data synthesis, data acquisition. Like coffee, right? You feel a little more energetic and more attentive, and then it goes away. That's a nootropic effect. A neurotrophic effect is something that actually improves brain health. It increases number of brain cells, neurons, increases glial cell density, increases synaptic richness, the interconnections, increases trophic hormones like BDNF, brain-derived neurotrophic factor, and several others. Or you can see it on MRI or CT scan as an increase in cerebral volume or hippocampal volume. So those are neurotrophic effects, actual brain health effects,
Right.
either trophic hormones or actual anatomic improvements. Well, so nootropic, temporary increases in mental capacity, neurotrophic, things that actually make your brain healthy. I pointed out because there's so much nonsense out there. You'll see an advertisement.
Yeah.
Makes your brain healthier. No, it doesn't. So, but it helps people navigate when somebody says, buy this supplement for $120 a month, whatever, and it's going to be good for your brain. Just because you increase concentration for it does not mean your brain is healthier. To get a healthier brain, there are things you can do, but it's not going to be a nootropic.
That makes sense. Speaking of supplements, I guess one of my final questions for you is that really is kind of just a way for people to lose lots of money, is trying all these different supplements, and a lot of them don't work. And I realize that for different conditions, you might want different targeted supplements. But if there's like, I don't know, your top 5 or top 10, maybe even the supplements that you yourself take that you think are really worth your money and really worth being incorporated into your daily life, and they're pretty stable, pretty safe, what would those be?
Here's a philosophy that served me very well, but took me many years to really understand what it meant. And that is almost everything I do, almost everything, is just restoring things that you should have been doing or should have been exposed to all along. So wheat, grain, sugar elimination. We're really reverting back to a style of eating that our species evolved in. The addition of wheat is a relatively recent thing. People don't think so, but it is very recent. Vitamin D, you're supposed to be outside, semi-naked, in a tropical or subtropical sun. You're supposed to be drinking water from rivers and streams that run over rocks and minerals rich in magnesium. You're supposed to be eating fish and shellfish and other things from water that has iodine in it. You're supposed to be eating the brains of animals and other creatures to get omega-3 fatty acids as well as fish. So everything we're doing is just restoring things that are restoring the microbiome back to the way it's supposed to be. Like the Maasai or Hadza or Yanomami or the people who live in the highlands of New Guinea. All these people have a microbiome very different from ours, very similar to each other, despite being separated by thousands of miles of ocean. So all we're doing is trying to revert back to that kind of lifestyle. So the nutrients that I find are most helpful are the ones that are just lacking. Magnesium, because we have to filter our water. Omega-3 fatty acids, because your wife won't make brain for you. And we can't eat all the fish we want, it's got mercury. Iodine, especially inland air, like where I am. I'm in Illinois, the former goiter belt. Illinois, Wisconsin, Michigan, all the inland cultures that don't have ready access to ocean foods rich in iodine. And then vitamin D, because we don't get enough sun. You wear clothes in public. As we age, we lose the capacity to activate vitamin D in the skin. And then, of course, efforts to restore a microbiome closer to the way it should have been. So all we're doing, at least in my programs, is trying to return to the way things should have been all along.
Got it. Okay. And so you're not spending tons of money on really, these high quality multivitamins or minerals or anything like that, as long as you're getting it through nutrition or returning just to whatever the normal homeostasis things that you're trying to target.
Every time we try to bring in some exogenous compound, it could be, name your new supplement du jour. They never seem to have the same kind of basic dramatic effects. Unless there's some, if you're a vegetarian, for instance, or a vegan, you need to get zinc and B12. all you're doing is restoring something you should have been getting all along from food. So whenever we introduce something exogenous, like a pharmaceutical or a nutrient that really does not serve an existing need programmed into your genetic code, I think our expectations should be very low. They typically don't do that all that much.
Got it. Okay. I just remembered I do have one last question I wanted to ask you about. So gut microbiome testing. Do you have a favorite method or company, method, whatever, test that you think is the best way to do it? I've experimented with tons of them. I've used Viome. I was an affiliate for Viome in the past, and then I read your book, and you had some pretty interesting critiques of Viome, and so there were some other ones as well that I've tried. Thrive. There's all kinds now. What is your preferred gut microbiome test, and is it worth it? What do you think?
We have to accept, Kenny, that microbiome testing is a flawed world. Mm-hmm. One, it's a rectal test. In other words, it's you and I would like to know what's going on in the ileum, for instance. Well, you can't. So you're stuck with looking at poop, which is a rectal sample. I have a friend. His name is Raul Cano, PhD, formerly on faculty at Cal Polytech in San Luis Obispo, and he did something crazy. He took the entire bowel movement of 1,000 people and analyzed the microbiome composition and compared it to those rectal samples. And Kenny, there was almost no overlap.
No way.
Different things.
Oh, wow.
And then others have done this. They've taken like a mouse's colon and sampled it like every half a centimeter or so. Every location is different. So we have to accept that what you get, the snapshot that you get in a rectal sample, is only a snapshot. It doesn't give you a full, there really is no easy way. I mean, we could say everyone should have a colonoscopy and get an ileo sample, but no one's going to do that, right? So the technology is flawed. And of course, as the technology has advanced and DNA sequencing has gotten better, it's clear that we should use DNA sequencing, as in Thrive or in Tiny Health, goofy name. They're also more expensive, though. But we do want methods that identify fungal overgrowth, methanogen overgrowth, as well as bacterial overgrowth, and even better if they include some of the physiologic markers like calprotectin and some of the others that helps you understand what's going on. So it is an evolving technology, and I'd say in the last 10 years, Kenny, it's gotten a lot better. But right now, I would say Thrive and Tiny Health are probably the best platforms, accepting their inadequacies.
Okay, that's really helpful. Awesome. All right, well, Dr. Davis, thank you so much for taking the time. That was really insightful for me, and I enjoyed it. It was great to meet you. You're one of my heroes. So thanks a bunch, and hopefully we'll talk again soon.
Thank you, Kenny. Hey, I want to stay in contact with you because I want to hear what happens as you go through training, as you go through a third and fourth year in training and see pushback.
Yeah.
Do you end up being the educator?
We'll see. Honestly, a lot of the times I keep my mouth shut because it's kind of like being, I don't know. Okay, if I speak too much, you might just get shouted down, or you might look like you're a know-it-all student. You think you know all the answers, and attendings really don't like that. And also it's like you said earlier, a lot of this stuff hasn't met mainstream or broad consciousness yet, and so. I used to get really kind of frustrated with my doctors when I was really sick. One of the things we always asked was, hey, could IBD be related to diet at all? And at least in 2014, we were told no. I literally was told that, and I remember it frustrated my mother so bad. She was like, getting in arguments with all the doctors and stuff. And at that point, I was really frustrated, and you can kind of see where there's this gap between patients with chronic diseases and the physicians. And the patients with chronic diseases, they start to foster this resentment towards the physicians, and they start to almost feel there's a conspiracy against them, like the doctors want to keep you sick. And I could feel myself getting tugged into that. But now being inside and going through medicine, a lot of the time, it's just doctors are trying to survive. They're trying to get through school, they're trying to study, pass their exams, and then when they get through training or start training, their lives get exponentially harder. And by the time they get home, they really don't have time to surf PubMed and look through all the different data that's there. And so they're not doing anything nefarious. They're really they're trying to live their lives just like everybody else. It's just that the problems that patients with chronic diseases are facing, they're not currently, or most of the time, not currently affecting those physicians that are in a position to actually kind of go down the rabbit hole and find things. And so,
Any idea what specialty you might go into?
I'm really interested in internal medicine to start, and then I want to do gastroenterology, and we'll see if that's a possibility.
I really hope, Kenny, you're the start of a change. It has to happen. My generation is so, as you point out, wildly out of touch.
Well, I'm excited to be in the up and comer echelon. It's a really exciting time because there are so many people who are interested in kind of getting the wheel turning and seeing what kind of bounds we can push and evolve a little bit. So,
well, I'll be a very interested observer of your career.
Well, thank you. We'll see how it goes. It has not been easy to get this far, and so we'll see if we can just one milestone after the next. We gotta get through the first thing, and then get to residency, and then the fellowship and all that stuff. But
I hear you.
Yeah.
But it takes courage. What you're doing takes courage, Kenny. I pat you on the back. That's fantastic, and you make me hopeful.
Well, thank you very much. Thank you very much.